do. Make me do for love what I would not do. Make me do for love what I would not do. Make me do for love what I would not do. Hello, everyone, and thank you for joining today. We'll get started here in just a moment. Go over a quick housekeeping, though. If you experience any technical issues, please submit those there in the chat to myself, Cameron Johnson. I'll be happy to address those for you. You will be joining the webinar on mute, but feel free to use the chat or raise hand function at time for questions. So with that being said, I'll go ahead and hand things over to Katie to get us started.
Excellent. Thank you so much, Cameron, and welcome everyone. We're really excited to talk to you today about some strategies for engaging systems-involved youth in adolescent and reproductive health. So today we'll do a little bit of welcoming and introducing you to the panel of amazing speakers we have. We'll talk a little bit about systems-involved youth and how they're served by the PrEP program, some best practices, and then we're going to have a project spotlight from our colleagues at Child Trends who run Activate, which is going to be publishing some really exciting and helpful new tools that we hope you'll check out. And we're really excited to be joined by two grantee spotlights today. We have Tekka Thompson and Maurice Cole from Ohio, and Rebecca James from Healthcare Training and Education. So I'll go ahead and introduce the panel, and then we'll dive into the objectives. I'm Katie Selentrap from RTI, and I help support some of our TA activities. We also have Rachel Rosenberg and Mindy Scott and Asari Afiyang from Child Trends, who are going to be talking with us about what they've learned over the past few years of work with these populations. We're, as I mentioned, joined by Tekka Thompson from the Ohio Department of Youth Services, and Maurice Cole, who's from Cuyahoga County, and Rebecca James from Healthcare Training and Education. So we'll go ahead and dive into the next slide. By the end of the training today, we are planning that you will understand the experiences that shape the sexual and reproductive health, behaviors, and service needs of system-involved youth, that you'll be familiar and learn best practices for recruiting and engaging systems-involved youth in your adolescent pregnancy prevention programming, and that you'll know where and how to access tools and resources about sexual and reproductive health to support specifically systems-involved youth, and that you'll be able to share these resources with other partners that you work with that serve this population of youth as well. And so who are systems-involved youth? We're talking about both youth in the juvenile justice system as well as youth in foster care. We recognize that there is sometimes crossover between these groups called either crossover youth or dual jacketed youth. So these are youth that are in both systems. We're going to be getting into more depth about additional factors about this population, such as overrepresentation of low-income families, families of color, and families who have experienced adverse childhood events within these populations. But we are clearly defining them as young people who have ever been in child welfare or juvenile justice. So what do we mean by foster care? That includes any young person who is in out-of-home care. This includes kinship placement, congregate care placement, or in a foster home. Juvenile justice includes any youth on probation, youth in a detention center, or an alternative placement as ordered by the justice system. And then crossover or dual jacketed youth are youth who are in foster care and juvenile justice. And you can be in both systems at one time or one system and then the other. So when we talk about systems-involved youth, this is the population of young people that we're talking about. If you want to go to the next slide, sorry. So why do we want to focus on this population, or why are we bringing this to your attention today? Well, so the numbers on the left of your screen, living situation, illustrate from the 2019 to 2020 performance measures that were submitted by you all, the PrEP grantees, that about 1 in 10 PrEP grantees are serving youth that are involved in systems of some kind. Or have run away, which are, those youth are often also involved in a system. These data are from a data brief that was published earlier this year about the performance measures from 2019 to 2020, and you can check that out on the OPRE website. It is also the case that youth in foster care and in the juvenile justice system report higher rates of early initiation of sexual intercourse, more sexual partners, and lower rates of condom use and other forms of birth control use compared with adolescents who are not in these systems, putting them at higher risk of adolescent pregnancy. I also just wanted to call attention to the fact that over the past several years, we have received TA requests on supporting systems involved youth. So thinking about how might we find evidence-based programs that are appropriate for this population? How can we adapt or tailor our programs to ensure that they're trauma-informed for the young people in these systems? And then how can we ensure that they resonate for youth in systems? So this webinar today is in response to those TA requests as well. And we hope that, as I mentioned, you'll find some interesting highlights to take with you and more resources to use in your work. I know that many of you completed a poll when you, some information when you registered for the webinar, but just so we get a sense of who is in the room, we wanted to launch a poll to understand more about your experience working with systems involved youth. So Cameron's going to start the poll for us. And if you could tell us, and you're allowed to pick all that apply, if you're an experienced organization already working with this population, you're an organization at the early stages of working with systems involved youth, you're just beginning to think about it, or you don't plan to serve this population, but you want to be aware of considerations since systems involved youth are often also reached through programming for general populations. And you should be able to pick more than one option. And it looks like we have many people who have participated, so I'll go ahead and end the poll and turn it over to, turn it over to Rachel, who's going to take us through the next set of this slide deck. And I saw, Rachel, there is one quick question about, does systems involved youth include mental health, residential mental health that's not state operated? I believe the answer is no, but I will let you clarify.
Yeah, thanks, Katie. I believe the answer is no too. Without a little bit more information, it's kind of hard to tell. It would depend on kind of what system that young person was placed through, but generally no. So great to see everybody today and to see so many of you are already working with system involved youth. As Katie mentioned, my name is Rachel Rosenberg and I'm a research scientist at Child Trends. And Katie covered the basics of who's involved in the child welfare and juvenile justice systems and the many factors that are associated with families coming into contact with those systems. It's important to understand why the current systems may not fully meet the needs of youth and families once they come into contact with either foster care or juvenile justice, and how programs like yours can help fill those gaps. The child welfare system was originally designed to protect young children and infants from physical and sexual abuse. Because the system was designed to serve infants and children, the policies in place often do not take into account developmental stages of adolescence and normal adolescent behavior. The child welfare system is really designed to be risk adverse in that its goal is physical safety. However, adolescents are learning, during that stage, are learning about healthy and unhealthy risk, which is developmentally appropriate behavior. And while learning how to take risk and learning boundaries are developmentally appropriate, this behavior is often punished within the system and can result in things like placement changes or increased level of restriction. The juvenile justice system is originally modeled after the adult legal system in this country, meaning it's not designed with the latest adolescent brain science in mind. The adolescent brain functions differently than the adult brain, and systems serving adolescents should model services that best meet the needs of adolescents. The adult legal system assumes adults are making rational choices and should therefore be punished when crime occurs. However, the juvenile justice system is supposed to be more focused on rehabilitation. With neither the justice system nor the child welfare system being designed to specifically meet the needs of adolescents, young people in foster care and juvenile justice may not receive the sexual and reproductive health education needed. I do want to mention, while there are evidence-based models within both the child welfare system and juvenile justice system to serve adolescents, the initial policies around those two systems are often limited in their ability to fully serve adolescents. Next slide. We're now going to dive into the foster care system and talk about the experiences of youth in out-of-home care. Out-of-home care or foster care includes any young person who has been removed from their family of origin due to abuse or neglect and placed in care, which can include a group home, a residential facility, a foster home, or a kinship home. Furthermore, throughout today's webinar, when we talk about older youth or transition age youth, we're referring to youth in out-of-home care between the ages of 14 and 21. Most older youth ages 14 to 21 enter foster care due to neglect or parent-child conflict. Once in foster care, around 20,000 young people age out of foster care each year, meaning the system failed to provide them with a permanent legal family after removing them from their family of origin. Of the older youth population in foster care, it is pretty evenly split between males and females, and older youth make up about 15 to 20% of all children in foster care each year. Black and Indigenous youth and families and low-income families are overrepresented in foster care. This is due to systemic racism and biases that lead to more Black, Indigenous, and low-income families being reported to Child Protective Services, being investigated, and ultimately removed from their homes. The over-surveillance of communities of color and low-income communities often drives this overrepresentation because of the increased presence of police and social workers within those communities. While older youth make up about 20% of the population in foster care, they have very different experiences than their younger peers in foster care, such as experience increased placement instability, meaning they are often moved from placement to placement, increased school instability that often goes along with placement instability, and they're more likely to be placed in a congregate care or residential setting. All of these factors may decrease their access to needed sexual and reproductive health education. While we don't have national data to provide an estimate of pregnant and parenting youth in foster care, studies show that it's estimated between 33 and 49% of older youth in care have ever been pregnant or impregnated someone else. This is higher than their peers not in foster care and may indicate a need for increased access to sexual and reproductive health education. Now that we've discussed who older youth in foster care are and some of their experiences, we will review some young adult outcomes among those who have ever been involved in the foster care system. These outcomes are often a result of their involvement in foster care or out-of-home care and include increased exposure and their increased exposure to trauma based on abuse and neglect and being removed from their family of origin, potentially their lack of social support once removed, and exposure to violence during childhood. Young people who have been involved in out-of-home placement experience an increased risk for having sex for the first time at a younger age, higher rates of teen pregnancy, increased exposure to sexual trauma, increased risk for sex trafficking or sexual exploitation, increased risk for rapid repeat pregnancies, and higher rates of STIs and HIV. We're now going to switch and review some information about young people in the juvenile justice system. Youth in the juvenile justice system experience many of the same barriers and young adult outcomes as youth in foster care, and as mentioned, many young people often spend time in both systems. This slide presents a bit of background information on the juvenile justice system, which includes youth on probation, youth in community placements, and youth in detention centers. Youth come into contact with the juvenile justice system for a range of reasons, including behavior problems, status offenses such as truancy or illegal actions, including both misdemeanors and felonies. In 2020, around 500,000 young people were arrested and had an initial contact with the legal system. Of those young people who were arrested and entered the juvenile justice system, either through probation or detention, about 28% are female and 72% are male. As I mentioned, youth can be in a number of placements, and it is important to remember the majority of youth in juvenile justice are not in detention facilities, but rather they remain in their communities. Similar to foster care, there is an overrepresentation of Black, low-income, and LGBTQ youth due to the oversurveillance of these communities and other systemic barriers. We have slightly better data at the national level for pregnant and parenting teens in juvenile justice than we do at the national level for foster care. By age 19, over half of women in juvenile justice have been pregnant, and around 18 to 31% of young men have fathered a child. These statistics indicate that young people in juvenile justice might need increased access to comprehensive sexual health education. As mentioned, young people in juvenile justice experience many of the same young adult outcomes as young people in foster care. Young people with juvenile justice experience are at an increased risk for having sex for the first time at a younger age, higher rates of pregnancy, increased exposure to sexual trauma, having multiple sexual partners, having unprotected sex, and higher rates of STIs and HIV. We will also note that many systems-involved young people go on to thrive in young adulthood and live healthy and happy adult lives. It's important to remember that system-involved youth are resilient, and when the system provides access to needed services and supports, can thrive in young adulthood. Next slide, thank you. You may be wondering how all of this information connects to APP programming. We're talking about these specific populations because systems-involved youth often have limited exposure to comprehensive sexual health education and may require modified curriculum to meet their needs. There are many reasons why systems-involved young people have limited exposure to comprehensive sex ed, including inconsistent school attendance due to being removed from their community of origin and experience multiple placements once in the system. When designing or modifying curriculum, consider ways to include a summary of past lessons or ways to catch students up that come into the program late or miss days of educational time. Additionally, there are often a lack of programs in group settings, which is particularly important for youth who are in group homes, residential facilities, or detention centers. This creates a window of opportunity for you to provide services within these facilities and to learn more about the unique young people often placed in residential programs. Youth may receive inconsistent information by adults and inconsistent access to medical care, which can be counterbalanced by accurate information provided by programs, both of which can leave youth with lack of information they need to advocate for themselves and make informed medical decisions. Lastly, they may lack access to education that is trauma-informed. Using trauma-informed sexual health education is imperative with systems-involved youth because they often have experienced trauma either by being removed from their family of origin and placed in foster care or a detention center, trauma associated with the cause of removal from their family, or trauma endured once in the systems. Many of you are likely already doing these things as you serve young people who are system involved and may have overcome these barriers. It's important to learn from others already working in this space as we move these programs forward. We are now going to walk through a series of recommendations for addressing the sexual and reproductive health needs of system-involved youth. We will talk through several programmatic recommendations for addressing sexual and reproductive health among system-involved youth. This includes acknowledging the unique circumstances that system-involved youth experience. This includes considerations from the previous slides, such as making sure the program is trauma-informed, takes into account that system-involved youth may be more likely to experience sexual exploitation and may not have access to consistent health care. We should acknowledge their unique expertise on sexual and reproductive health. Many young people are fierce advocates for themselves and may have experience and knowledge that can be helpful during comprehensive sex ed. We should acknowledge sexual trauma and exploitation and adjust programming as needed. Many system-involved youth have experienced sexual trauma or exploitation. It's important to note and consider in programming that this is taken into account and does not demonize that behavior. We should ensure conversations are safe spaces for youth to be honest and open. Conversations about sexual and reproductive health and education must be non-punitive and non-judgmental. We should avoid making assumptions about level of sexual activity, sexual orientation, or gender identity. It's important to let young people share these pieces of information with you and ensure you are providing a comprehensive education that is comprehensive and inclusive. We should connect youth with supportive trauma-informed medical providers. Youth need access to medical providers who are trauma-informed and can provide needed sexual and reproductive health care. And lastly, we should connect youth with resources and education in their communities. It's important to connect youth with resources within their current and home communities. It is best for these resources to be accessible even if they are no longer in foster care or involved in the juvenile justice system. To ensure sexual health education is inclusive and tailored to system-involved youth, you should be engaged in the development and implementation of sexual and reproductive health programming. You should be engaged using a strengths-based approach, and you should be engaged in the systems reform efforts that might be needed to advance sexual and reproductive health programming. This might include changes in policy and practice to allow for comprehensive sex education that is tailored to meet the needs of system-involved youth. Involving youth in all aspects of programming helps to ensure your program is relevant, inclusive, and will resonate with the young people. In the next section, we are going to cover best practices for engaging youth. Before we move into discussing tips for engaging youth, we want to see how you, if at all, are already engaging young people in your work. You will see a poll on your screen, and please answer the following question. How have you engaged system-involved youth? Have you engaged them in program design, program implementation? Have you engaged them in the creation of practice-based tools and resources? Or have you engaged them in another way? And if we could open that second poll, please. Thank you. So it seems like many people have engaged young people in program implementation, a handful in program design, and a handful in the creation of practice-based tools. I think we'll go ahead and in the poll. Thank you. We can go on to the next slide. Engaging system-involved young people in the development and implementation of programming helps to ensure the program meets their needs, centers the lived experience of young people, and is tailored to address shortcomings of the systems they are involved in. The following slides go over that information. On this slide, you will see the best practices for engaging system-involved youth. First, avoid tokenism. Tokenism is the appearance of involving young people without actually giving them a voice. Tokenism can also look like only involving a small number of folks from different groups, such as LGBTQ and different racial and ethnic groups, and expecting them to speak for all young people who share that identity. Tokenism is giving a seat at the table without a voice. One way to avoid tokenism is to engage at least 2 young people in all activities. We should ensure the organization is ready and willing to authentically share power with youth. This is important since organizational support and policies will often influence their experience. For example, ensure your organization is able to compensate youth and there are not policies prohibiting that. Should clearly articulate aspects of the program that cannot change. You should be honest and transparent about aspects of the program that can't change. For example, if something is a grant requirement, it may not be flexible, but other of the components of the program might be. Focus on those components that can change. Focus on the pieces that can change. The last point goes with ensuring you have organizational support and ensuring there is consistent and specific point of contact for the youth you are engaging. The youth should have someone they can reach out to with questions, and ideally this person should remain consistent across the time of engagement. In addition to the items discussed in the last slide, we also recommend you allow youth to choose how they want to be involved. They should be given information on all tasks and then allowed to choose how they would like to engage with the project. Should ensure that engagement is mutually beneficial. One way you can do this is to align opportunities with youth's developmental or career goals. This helps to ensure they are learning new skills and opportunities, as well as providing expertise to the project team. As mentioned, always compensate youth when engaging them as experts. Youth should be compensated at the same rate as all other experts being involved in the program design and implementation process. We should always incentivize participation when engaging youth as research participants. Be sure to consider and address barriers to participation, including transportation. One way you could address transportation is by ensuring the location of the meeting is on a bus line or providing vouchers for a lift. Another example is childcare, which could either be provided during the meeting or allowing young people to bring their children. Consider the time of day. Time of day is particularly important as some youth may be in school or working and not available during a typical 8 to 5 workday. And lastly, consider competing priorities. Young people are often engaged in many different things, which includes being aware of the other commitments youth have and working with them when scheduling meetings. Next slide. Now that we have covered the background of foster care and juvenile justice systems and shared a bit about the experiences of young people in those systems, we want to hear from you. As you start on the journey to serve or continue serving system-involved youth, do you know where to access research-based resources to support your work with these populations? We could open the third poll, please. So it seems that many people do know where to access services, and many people don't. So we're kind of split on that, which is completely fine. We are going to, in the next slide, hear from my colleague Mindy Scott, who will cover one project that aims to translate research on sexual and reproductive health for system-involved youth to practice resources. We can go ahead and close this poll.
Yes, hi everybody, thanks Rachel. I'm happy to talk about one specific center that's dedicated to creating and disseminating research-based resources, specifically for professionals that work with system-involved youth. I'm Mindy Scott, I'm a senior research scholar at Child Trends. And appreciate the opportunity to talk about our resources in our center today. The center is called Activate, the collective to bring adolescent sexual and reproductive health research to youth supporting professionals. And on the next slide, we have just a little bit of background. Activate is funded by the Office of Population Affairs, and it's a research to practice translation center and led by Child Trends in partnership with Chapin Hall and Healthy Teen Network. The goal of Activate is to conduct and translate adolescent sexual and reproductive health research into practice. And we do this through the creation of resources for professionals who work with young people with specific experiences, including system-involved youth, so youth with direct experience with the child welfare or juvenile justice systems. Also, though, youth experiencing homelessness and then youth disconnected from school and work, sometimes referred to as opportunity youth. So our our focus is a bit broader than sort of formal system involved young people, but we consider sort of those overlapping experiences and know that there's sort of an intersection of and sort of salience of other experiences like homelessness for system involved youth. As part of our research translation efforts, we work to gather, synthesize, and disseminate research, and we engage in an extensive network of individuals and organizations. We engage those networks in our resource creation, and young people and providers are both part of this. So our approach to the work that I'll talk about a little bit more on the next couple of slides, I think really reflects some of the best practices that Rachel discussed in terms of bringing youth to the table when thinking about resources and content related to adolescent sexual and reproductive health. So our primary audience is the professionals that work either directly or indirectly with young people in systems. This could be caseworkers, program administrators, program facilitators, health providers, so pretty broad range of professionals. But we do engage other types of partners and audiences in our work, including young people themselves, researchers, policymakers, and TA providers. And then on the next slide, I wanted to just feature a few of our resources just to kind of give an idea of the types of tools and resources that are available through our website, activatecollective.org, and we'll provide a link to that in a couple of slides. We have many resources that are coming out by the end of this month that we're really excited about. Our resources take the forms of tip sheets, fact sheets that summarize current research, online trainings, guided practice tools, infographics, kind of just diverse sort of short, more accessible resources to get the information out there in more user-friendly ways. As an example, one of our most popular resources is a tip sheet on how to talk to system-involved youth about their sexual and reproductive health. And it really focuses on some more of the unique contexts and experiences specific to youth involved in systems, and draws from research guidance on communicating with young people, but then also guidance provided by young people and providers themselves about sort of successful strategies for communication about these topics. And again, for all of our resources, the content and the format is really decided in collaboration between researchers, young people, and providers, kind of across all of the work that we do. The other resource I wanted to highlight is a reproductive health resource explorer. So we have learned through our work that professionals are really looking for easier access to research-informed resources. And so in response to that, we've developed this web-based resource explorer, and it focuses on a range of sexual and reproductive health topics and kind of features resources that are specifically focused on research and practice related to system-involved youth. So I think it's just a fantastic place to go for resources, sort of all really dedicated to discussing approaches for youth involved in systems. I think there's around 66 resources currently, and then we are sort of constantly monitoring about 100 websites and organizations, and update the Explorer quarterly. So just a good place to go and kind of keep looking for resources there as we update that. And then just a little bit of a plug for our forthcoming resources. By the end of the month, we're going to have several more tools and resources available that I hope are helpful for this group and for any professional working with system-involved young people. We have some Q&A guidance around intimate partner violence and sex trafficking, training for addressing sex-based harassment in the workplace, several different tip sheets and practice guides related to birth control, methods and access, the social determinants of health, trauma responsive and LGBTQ+ affirming approaches, just to kind of give you a sense of the range of topics and formats that we have for communicating the research on these different topics. And I will provide a link for the website before I wrap up. I wanted to just say a little bit more about our approach to research translation and how young people and providers are involved in that. So ultimately, our main priority for the work is to engage our key audiences, including youth supporting professionals, youth and researchers in the work, in the research translation and resource development process. This helps to ensure that the work is relevant, that it's timely, really reflective of current practices in the field and also current research. And we make sure to prioritize the voices of both professionals and youth. And again, thinking about making research really accessible to professionals in terms of ease of accessing those resources, but also the content and the concrete strategies that we include in the resources. And engaging youth and youth supporting professionals has been really critical to meeting that priority and developing our resources. So we draw on research for the resources, of course, but also the really critical input and lived expertise of young people and providers, both. This helps to ensure that our resources are authentic and aligned with the realities of what young people experience and what they need from professionals that work with them to address their sexual and reproductive health. Youth and professionals help us gauge the capacity of different types of professionals, kind of given especially the range of different types of professionals that we're thinking about. Some are more or less equipped to talk about sexual and reproductive health and really provide those services either kind of themselves or knowing other professionals to bring in, but really wanting to make sure that our recommendations are within the capacity of those professionals and the work that they do and the role that they play. And then also really thinking about providing clear examples of how to do these things, and not just sort of saying what to do, but really being really specific in how to implement some of those strategies that we're talking about. If you are interested in accessing and using our resources, you can access them through the website, activatecollective.org. And then also you can sign up through this Contact Us page to receive updates and when we have new resources. So you'd get an update automatically when we have new resources and then other information from the center. So I hope that you check us out and find the tools helpful. And if we're gonna move to the next slide, I appreciate the time, as I mentioned, to kind of highlight our center and the resources, but really I'm excited to now introduce the people and the organizations that are doing this work in real time to get a sense of some of the strategies we've been talking about. So we're going to move to our grantee spotlights. And first, Tekka Thompson and Maurice Cope will tell you more about their work in Ohio. And then we'll hear from Rebecca James about the work that the Healthcare Education and Training Organization is doing. Thank you, everyone. And I'll turn things over to Tekka.
Thank you, Mindy. My name is Tekka Thompson, like Mindy said, and I work for the Ohio Department of Youth Services, and we have been a state PrEP grantee for approximately 10 years. So we've been servicing system-involved youth with the support of the PrEP grant since 2010. Our target populations include, of course, foster care and juvenile justice involved young folks. And also in when we engage foster care youth, we also engage youth in transitional living because our target population, we service kids 14 to 21. So we can also work with kids who are actually starting to age out of foster care through our state transitional living program. And also in the juvenile justice system, we work with kids that are also pre-adjudicated that might be going through a diversion program or a day court reporting program too as well. Next slide, please. And so in the state of Ohio, our structure is that we have 5 sub-grantees and our state is divided into 5 districts. We have 5 coordinators who basically are doing the work. And today, one of our coordinators are here with us, and he'll be able to tell you some more boots on the ground. But we do have 5 districts, and we try and cover the state from the top to the bottom, where we are servicing kids in urban and metropolitan areas, as well as rural and the Appalachian areas in Ohio. Next slide. And our structure, we use a train-the-trainer model. So in a sense, my coordinators are out in the community recruiting agencies, foster care providers, and juvenile justice agencies to join us in partnerships. And we train their staff to implement our evidence-based curriculum. We found that this was highly valuable during the pandemic because many of our partners we're able to keep right on rolling in providing the services to our young folks. We also did switch to kind of a hybrid model where we also did some teaching because we wanted to be available to our partners. We have about 1,500 to 1,600 trained partners. They're not all active. And we just recently added a layer of sustainability into this structure where we've taken some of our longstanding partners who've been with us for 8 to 10 years. And we've also trained them to be train-the-trainer so that they can train within their own agencies. And so if all PrEP funding went away, these community partners would be able to implement the PrEP program with about $1,000 and continue to do the work on their own. And so our goal is to continue each fall to recruit long-term partners to become train-the-trainer so they can do this work in their agencies as well. Next slide, please. So our interventions are, our evidence-based interventions in adult topics are, we can go to the next slide. So we actually have 2 evidence-based curriculums that we use in Ohio. We started off in 2010 using Reducing the Risk, which was about 20 hours of instructional material. But as we moved through working with our partners, and especially and particularly working with juvenile justice involved youth or systems involved youth, we noticed that we needed a shorter intervention. And so we moved to meet the needs of our partners, and we added Making Proud Choices, which is about 13 instructional hours. And now most of our partners are switching over to Making Proud Choices, which has been really helpful because oftentimes when you go into a juvenile justice facility, there's a really tight program schedule. And so you really need to get in and get the work done, but still do it to fidelity. And likewise with young folks in foster care, because sometimes they're coming from different foster cares and traveling to your group. And so we want to lessen the travel time that our partners are coming. So we needed to shorten our intervention. Next slide. And our adult preparation topics that we use are education and career success, healthy relationships, and financial literacy. We also have parent engagement as well, which we really target. A lot of our foster care folks are doing our parent engagement program, which is Beyond the Birds and the Bees, where we're teaching foster care how to answer questions and have conversations around sex. We also use this program with juvenile justice professionals as well. Next slide. And now I am going to step back and let my subgrantee, Maurice Cole from our District 2, Cuyahoga County Board of Health, kind of give you a boots on the ground view of what everything I just explained to you, how it actually looks in the community. So I'm going to hand it over to you, Maurice.
I appreciate that, Tekka. Thanks. It's great to be with you all today. I am Maurice Cole, he, him, and I work at the Cuyahoga County Board of Health. I am the current prep coordinator for District 2, which covers a 14-county area. Ohio is one of the larger states in our country. We're in the top 10 there. Shout out Ohio. But we are both rural and suburban and kind of everything else in between with 88 counties. We cover 14. So thinking of larger cities like Lorain, Cleveland, Akron, Youngstown, Canton, and even Ashtabula out to the far east. So we run out to the, sort of Pennsylvania border with our district. But next slide, I'll talk a little bit about some of our partners and what we do. And we're definitely going to highlight and kind of lift up two of our partners that you'll see there on screen. But let me share that from the prep perspective, we are engaging agencies and recruitment. We are facilitating those trainers to bring prep providers in so that they are more comfortable with the curriculum and teaching to fidelity. We also sometimes co-facilitate making proud choices and reducing the risk. As Tekka said, we sort of launched a hybrid model because the world changed a bit back in 2020 with COVID. And so like one of our partners was able to purchase tablets for their youth. So we just took the curriculum and sort of infused that into a Zoom and sort of Teams capacity and met the youth where they were so that we could continue to offer instruction. Also providing technical assistance, youth incentives is really important. I do want to highlight that, and like offering quarterly coalition meetings. And some of those topics that we've covered with the coalition meetings include issues of equity, diversity, and inclusion, adolescent sexual health, suicide prevention, human trafficking, domestic violence awareness, and of late, more about mindfulness. There's a great article on NPR today about our breathing and how we need to be a little more thoughtful perhaps about that. And some of the benefits of that trauma responsive care, which is maybe even attempting to be the next beyond trauma informed care. But thinking about incentives, it's important. And sometimes there are challenges. And one thing I heard in the earlier presentation talking about the rural versus suburban. So some of our youth would prefer Target gift cards because that's what they have access to. But in other rural parts of the community and of the state, Walmart is more popular because people can get to. So being aware of sort of your partnerships and that coalition building and allowing the youth in those agencies to really inform what we do has been very important. That coalition building really requires advocacy and consistency and flexibility because things change. So thinking about the two partners here, I'm going to have you flip to the next slide. And give some credit to the Cuyahoga County Juvenile Detention Center. They've been a partner with PrEP for 8+ years. They implement programming really throughout the year, but especially during this intersession, which is something for our juvenile justice involved youth, system involved youth. So there are times when the traditional sort of school is set aside, and during those breaks, that's a great time to offer PrEP. So that's what we've done there. And we generally run, 3 to 5 cohorts at the Juvenile Detention Center at one time. So we're capturing a huge number of youth and doing that on a sort of rotating basis. They have been a fantastic partner. We did lose some time in COVID. Sometimes, there were outbreaks. And so we needed to, they needed some staff changes, but the Zoom and Teams again allowed us to get in whenever we could. And then moving on to the next slide, I want to lift up Presley Ridge, who's one of our foster care agencies. As you see, they've been around for nearly 200 years in the greater Cleveland area. They have some amazing foster parents that have allowed us to offer up Beyond the Birds and the Bees. So we're training them to, again, have more engaging conversations around intimate topics related to adolescent sexual health. They also offer cohorts throughout the season for us, and it's just really been tremendous. And I'm also excited to share with you all that we are having our very first PrEP Wellness Day for the district. It's this weekend on Saturday. So we've invited our agencies and their youth and staff to come out for a full day. We've got mindfulness exercises. There's a ropes course that's on the ground because I'm afraid of heights, and that was a little scary to hear, but we're also going to be providing breakfast and lunch through food trucks. And also lastly, to lift up evaluation, because it is important that we get feedback from the youth, which is why I think the incentives are so critical. We try and offer a pizza party or a food of the youth's choice after they finish their cohort. But our evaluation team at Ohio University is really sort of kept us on our toes and continue to document the work that we're doing so that we can report that back and show how we're hopefully having a more positive impact on youth and their families. And with that, it's maybe time to turn to our next partner, Rebecca.
Thank you, Maurice.
Thanks.
Hello, everyone. My name is Rebecca James, coming to you from Indianapolis, Indiana. I work for Healthcare Education and Training. And if you can advance to the next slide for me, please. Thank you. Just wanted to give a quick funding acknowledgement to the U.S. Department of Health and Human Services Administration on Children, Youth, and Families, of course, the Family and Youth Services Bureau, and PrEP for the funding and support of our IMPACT project, which is Indiana Proud and Connected Teens. Next slide, please. So a little history about who we are. I would love to just give you a quick overview and introduce our organization to you. So again, we're Healthcare Education and Training, or HCET for short. We're an organization of very passionate people who are proactive in our belief that access to evidence-based, medically accurate, reproductive, and sexual health education, training, and care is a fundamental right. Our mission since 1994 has been to provide comprehensive program development, education, and training to improve reproductive and sexual health outcomes. We work collaboratively with professionals, healthcare systems, community-based organizations, as well as state and local government agencies throughout the Midwest on a variety of different projects, with offices in both Madison, Wisconsin, and Indianapolis, Indiana. And we have been very fortunate and lucky enough, very similar to Ohio, our stories really do align, to have been a FSBE grantee for 10 years now. And we are currently in our third iteration of our IMPACT program, which again stands for Indiana Proud and Connected Teens. We are implementing Power Through Choices as our evidence-based curriculum. And this curriculum is written specifically for youth who are involved in juvenile justice and child welfare systems. We have previously implemented the Teen Outreach Program curriculum and the Be Proud, Be Responsible curriculum over the course of our time with this grant. And since we are a training and technical assistance organization, we do not actually provide direct service. So our staff and team is not out providing the day-to-day boots on the ground program delivery, maybe like Maurice. However, we subaward our funds, similar to Ohio at the state level, to our trusted partners who then implement our programming. That is because we recognize they are the experts of their communities, and they also have established trust and have strong relationships among the implementation sites and stakeholders throughout the community. Next slide, please. Oh, next slide again, please. Those are our partners. Thank you. So today I want to talk briefly just a little bit about some lessons learned over our 10 years working with youth who are systems involved. So through a lot of continuous quality improvement and feedback from our young people and surveys and working in collaboration with our evaluation team, we have learned that there are a high percentage of gender and sexual minority youth among youth who are in systems. Our youth have high levels of adverse childhood experiences, or ACEs, so we see high scores there. And we have also learned, as was previously mentioned, that we are providing a secondary prevention to our young people, meaning that a lot of our young people who are in care have already experienced a pregnancy, maybe are already parenting or have had a child. Next slide, please. So for our gender and sexual minority youth, we have been able to survey over 1,600 youth over the course of our project. And we have learned that gender and sexual minority youth are more likely to be involved in foster care system or to be dually involved, as was also previously mentioned. And it's specifically interesting because you will see it's foster care or dual involvement rather than just juvenile justice alone is what we have learned from our participants. A large minority are identifying as female, and a high percentage of gender and sexual minority youth have reported experiencing dating violence, victimization, and perpetration. Next slide, please. So the second lesson learned is the high levels of ACEs scores, or adverse childhood experiences. In our surveys and in our work, we are only measuring ACEs that are related to environment. And what we have learned, as many have already recognized, many ACEs are associated with dual system involvement. We have seen a higher pregnancy risk behavior. So for example, many young people reporting not using condoms, high substance use levels, number of partners, et cetera. Many have reported negative attitudes towards abstinence and positive attitudes towards pregnancy. And you'll see in our chart there on the left, impact ACEs scores are significantly higher than a couple of our other projects who youth in rural Indiana have been school-based settings and are just very different. So it's very telling, and we've learned a lot just about ACEs and the special population we're serving. Next slide, please. And then we looked at primary versus secondary pregnancy prevention, which I mentioned earlier. So based upon our surveys and our ongoing, very robust evaluation and data collection, we have had youth report that 86% have ever had sex, 60% are using condoms or birth control, just over a third at 34% have reported being pregnant, and 20% have reported 2 or more pregnancies. And I think this kind of corroborates what we were hearing earlier and understanding how it can be hard to get a hold of that national data, but this is what we've been able to capture over the course of our 10 years working with youth and systems. Next slide, please. And then a little bit of feedback, as Maurice just shared, that qualitative feedback from our young people is really important. So as we are implementing our programming, we too are listening to our young people and making sure that the programming is relevant and making adaptations as needed. And so we look very closely at this information, and this data is very special to us. And you'll see that the primary responses, so the most popular responses from our young people about what they like to see in terms of programming and topics. So our males have said they want to learn about how to be a good parent. And to quote some young men in particular, just how to take care of kids. And then second to that, they were interested in the practical aspects of sex. And then from our female participants, the most popular request has been information on sexual victimization and trauma. And then specifically noted talking to partner about safe sex without being scared. And then following that, an interest in gender identity and sexuality as topics. Next slide, please. That's it. So I think I'm passing it over to Katie. I might be, yeah.
Yes.
Yes.
Awesome.
Thank you.
Thank you, Rebecca and Tekka and Maurice. This is really, really great. I did see a few questions in the chat, but before we do that, we'd like to do this self-reflection activity. And then we can move into some Q&A with our presenters. So we want you to think about, given all of the information that we have talked about today or shared with you all, in this Jamboard. So I think, sorry, can you put the Jamboard in the chat for us? Can you please tell us, what have you learned today that might shape your work moving forward? And we thought it might be helpful to sort of talk about it if you're currently working with systems involved youth, or if you're not currently working with systems involved youth. So go ahead and take a minute to think about, where does your organization fit? And you click on the, oh, this is a view only. So to get to access the Jamboard, let's see, there should be a place to get a sticky note. Oh, sorry, or Rachel, can you tell us how to get a sticky note?
Try to refresh the screen here. Okay, it seems like people are able to join. I will troubleshoot that. So when you are joined, if you're able to edit it, on the left-hand side of your screen, there'll be a control bar, and the fourth icon down is a sticky note. And everyone should be able to edit it now. Do you mind refreshing this view just one more time? There we go.
Yes, now I see that.
That little sticky note right there. Yep. And then you can type and just hit save, and it'll populate right on the screen for us.
So go ahead and take a minute. And if the Jamboard's not working for you, you can also put it in the chat.
And just to clarify, I don't know if we mentioned this, that you would put your sticky note based on if you are currently working with systems involved youth or not currently working. So you can put your sticky note on the column that makes the most sense for you.
Anybody else want to share? Looks like we have a few in there. So we have some reiterating the importance of data and evaluation, funding agency staff to be trained trainers to support sustainability, offering beyond the birds and bees to foster parents, new resources from Activate, thinking about that the preventive work with this population might be secondary work prevention, more for Activate, involving youth in the creation of programming. So someone is they're currently in the process of establishing relationship organizations with the population, but they haven't worked with them directly. Expanding our reach and what youth they work with. Awesome. A note that the grantees should connect more often. There are so many similar stories and experiences. Acknowledging the unique circumstances that systems involved youth experience. Becoming knowledgeable about different preventive programs, being trauma informed in program delivery is of the utmost importance. Great. Go ahead and take one more minute for anyone else that wants to share what they've learned today with us. Reach out to sites with system involved youth to offer the program. Train the trainer model, consider that with your subrecipients. Well, thank you for taking a little bit of time to process what would be different if we're offering an online program to systems involved youth. We do have a little bit more time for questions, so I'm hoping we can, please continue to add to the Jamboard and we can come back to it, but I'd love to pose a couple of these questions to our panel of presenters. So the first question that I have for the group is, so Taylor Chambers wrote that they work primarily in juvenile detention centers, and they've recently had a lot of pushback from youth that the engagement is at a low, and attempts to engage them often fail. This, they think, is stemming from a need to be in control in some way, which the youth used to be able to have because they could opt out of the program, but the young people are no longer able to opt out. And so the question that we have for the panel today is, how do you engage youth who don't want to be engaged in sex ed at all? So I don't know who would like to take that.
I can maybe share a couple thoughts, and then I'd love to hear reactions from others. I'm curious, and you may have already done some of these, so please let us know if that's the case, and we can maybe come up with some other ideas. I'd be curious to learn more about kind of why they don't want to engage, and really trying to get at the kind of root cause of that. It may be something around the environment, around the other, young people in the class, just really trying to understand kind of what's fueling that want to disengage. And then maybe working with the young people to think through ways in which engagement would feel more interesting or align better with what they do want to learn, and try to kind of tailor things a bit to that group of young people. I'd be curious, some of my other panelists, if you have any thoughts.
Yeah, I did see that in the chat early on, and it made me think of, I don't know, sort of like gathering a focus group with some of those youth to hear from them directly, as you kind of said, Rachel, like what might be driving that. And I would also say that, my real-time experience has been, even when we are offering, the reducing the risk or the making proud choices, there are role play exercises involved as we're trying to impart these skills to the youth. And, when you're in a, I don't know, it's all boys that are, 14 to 18, and they don't really necessarily want to pretend that they're in a relationship with each other for the purposes of this exercise. But we really try, and I think the curriculum does a nice job of kind of building up those skills, because you're also building rapport. Like the introduction of, these curricula is really designed to kind of build this sort of team cohesion, so that when you get to that point later in the curriculum, it doesn't feel so awkward. And sometimes we have to say, now, again, this is sort of make believe, this is pretend. Sometimes I'll give them like a action as if we're like, on some movie set. We can maybe sometimes move around the room and kind of set the stage for what's going to happen so that people can impart that lesson. But it's, like youth probably don't feel as though they always get to decide as much as they might like to, but within the structure and confines of our program, sort of how to try and massage that so they do feel like they have an active role, I think is what I would try and do. So I might want to just ask the question like, hey, what's this about? Let's kind of talk through. But it's a great question. I don't know if that helps at all, but from my perspective, others.
I think I would just add to that, just to say, because young people have very different experiences of sex ed, and maybe just understanding what have they experienced or what they haven't. And just to kind of piggyback on Maurice and Rachel, I think that foundational information about what are the reasons why, then I think you'll be able to tailor your program or make some adjustments or reassure them that this program is structured differently, or these are the things that we're going to be talking about. It's not going to be judgmental. It's not going to, so I think it really is understanding their framing and their foundation.
Thank you.
It might also, oh, sorry, Katie. I was going to say it might also help, and something I would recommend is, if you haven't already done so, is really looking into an opportunity to monitor or observe sessions and having other people do so that you have this kind of this group that's wrapping around and then debriefing on what they think the root issue may be, because sometimes it could be the facilitation style as well. You can uncover things when you usually have other people get involved and help with that quality improvement piece. They can really help kind of change the dynamic of the room if you lean on some others for support as well.
Great. Thank you so much.
One more, like one of the training modules sort of early on is to engage our providers in an exercise about if they remember their sort of best teacher and maybe their less favorite teacher, and what were some of those qualities. So we talk through and try and encourage them to be, some of those sort of best educators, and to be more fun, and also to leave our, sort of packed judgment at the door, because we really are committed to this, prevention curriculum. And so we're going to operate from that space that this has been designed to encourage youth to make an informed decision about, themselves and their situation. But I also see Kelly, if she might want to chime in, Kelly from ETR, She's provided some trainings because I did forget to mention that we also during this time have been able to offer virtual training through ETR directly for some of our providers. So we've been able to get them trained by ETR and then come back to us for the adulthood module. So Kelly, I would love to invite you into the circle to comment a little bit about that, if you will.
Yeah, sure. So it's been great listening to all of you. Maurice and Tech, I was really excited to see your names on this webinar. Yeah, so at ETR, we have been doing the virtual TOEs, and we've been supporting a lot of Maurice and Tekka's folks, getting them trained. And also, since they have implemented, in sort of a hybrid way, coming up with, getting to see what it's like virtually, since the training itself is virtual, getting ideas for, different ways to do the activities. I wanted to quickly mention that there is a version of Making Proud Choices that is specifically for youth in out-of-home care. And that is available on our website. So if folks are interested in that, it's very similar to the original Making Proud Choices, but there's some changes and sort of more of a focus on trauma-informed lens than the original MPC has. So I figured I'd just mention that as well. And then just personally, when I was a prep grantee, I worked with a lot of juvenile justice involved youth and foster youth and everything. So that's why I was bringing up that question, because we always just had so much trouble keeping the same young people from the beginning of MPC to the end. And so I was looking for some feedback there, but.
Yeah, great question. Thanks, Kelly. And I think Doug Cope Barnes has put in a little bit thinking about a shorter program, but also, I don't know, Maurice, if you want to talk about, it sounds like from your implementation that you all implement like in a pretty short amount of time, pretty intensively. Am I capturing that right? So you're trying to capture the going 5 days in a row for longer hours to kind of get them in.
Well, we kind of let the system decide. And so in that regard, I'm not sure, how the youth get to inform that. But for instance, like with Making Proud Choices, so the 8 hours of the curriculum that has been developed by ETR, they're all 60-minute sessions, which is so much more than reducing risks sort of in a different way, because sometimes, that might be 42 minutes here or, 26 minutes there. And so I think that, that helps. And it's really about sort of that buy-in at the beginning to inform the youth, to really invite them to be a part of the process. And I mean, there have been times where just again, sort of real time, that a youth, let's say, was at one center and then they're transferred or sometime make it to another, and that program is there and they're like, hey, I already did this. So, from our perspective, like we were inviting this to allow that youth, maybe to do something else if they've experienced that, they get a certificate that says like you've completed this program, there's a party afterwards, there's kind of a celebration. But there have been other times that youth have been invited to kind of be sort of a model, if you will, because they've had that experience to kind of be that sort of veteran resource, which can kind of be fun for youth in some capacities too. So it's a bit of a hodgepodge, but I think trying to be responsive to youth as best we can is kind of where we should.
Excellent. Thank you so much. Another question from Eleni. Organizations and agencies in child welfare are already at capacity. How do you get partners on board sustainably? Who would like to take that?
Can you repeat that? I'm sorry. I was trying to read and follow the chat. And so even though my ears were on, I didn't really process all of it.
So the question is, organizations and agencies in child welfare are already at capacity. How do we get partners on board in a sustainable way? I think Ohio, you guys have talked about your long-standing partnerships. How do you do that?
Wow. Well, there was a point in time in the early days where some of those agencies and the participants were incentivized themselves, not just the youth, but, like folks got a $10 gift card for coming out for a couple of days of training. But we do try and feed them well. And so, fresh coffee and juice in the morning and breakfast and a nice lunch and some breaks along the way. Every now and again, we get some folks who feel like they were voluntold to be present. They're not really super stoked to be, a facilitator of X curriculum in the near future. But again, we try and work through that. Some of the exercises in which we're kind of building community at the beginning, I think, begins to maybe disarm folks from some of that. I can remember one of our early trainings, actually when Tech and I first met. And so the Department of Youth Services, these were all folks that were working in the juvenile correctional facility. So thinking about, what's on their plate every day and keeping mindful of security, rehabilitation, and all of those things. And they were, I would say probably from like 30 to 60 was sort of our demographic. And some of these guys that were like, my dad's, contemporaries, they were like, we're doing what? You want me to read what about? Like, mister, I'm not interested in this at all. And I just remember thinking, so this is the moment where your uncles are looking at you at the cookout and they're like, kid, you're not about to show me anything. And I need them to buy in. So what does it take to get Uncle Thomas around so that he's like, follow the script? And so I found one partner and kind of focused on him, zhuzhed him up a little bit. And once he bought in, then some of his peers were like, oh yeah, we can do this. Can I take my turn? I want to role play this too. So, sometimes on the fly, you got to kind of figure it out. And thankfully for us, we've had a lot of success. And some of those longstanding partners can also reach out to other folks that are a little less certain. And so sometimes using your network to build larger capacity can really bear some fruit as well.
Thank you. Anybody else want to answer that one? There was a follow-up question about specifically in outreach. Many organizations already have programming and don't have room for more, for example. Has anyone faced that in their work, and how do you overcome that?
So I think it's very similar to what Maurice just said when you're working on sustainable partnerships, in that you have to identify the champion in the room. And so like, where's your access point is what I've always said when it comes to outreach. Where's your access point, and what's the easiest and most attainable access point? So who knows who, that networking, and who's going to come and give you the time, and start there. I think a lot of times it's like you're given this list and there's like 95 places you can go in the state and they're all great and they all need you, but you're going to have way more success if you connect with your champion. And I always use the analogy of like when you're working with a school, it's probably not the teacher or the principal. It's often the custodian or the social worker or the secretary. So like, who's your champion in the room is what I always recommend for partnership building.
Awesome, thank you. And Andrea had some advice to pay your facilitators. So they pay Department of Social Service employees who work with older youth who are aging out of foster care. So those social workers or employees already work with older youth to teach them how to prepare to be on their own and take care of themselves. So these programs kind of tie right in. I know in some of the states that I've worked in on this topic, they were prepared. A lot of young people, particularly those who are transitioning out of care, have to do independent living classes. But those classes are not necessarily prescribed. And sometimes agencies don't even know what to offer, or they want to offer something more, but they don't have the capacity. So that's another great opportunity to maybe start with something there. The adulthood preparation subjects really fit in really well to independent living skills, which are very vaguely defined. And it depends on the agency, but there might be an opportunity as well. Or taking something off the plate of the agencies to start thinking about, like, we could train you in this so you don't have to look for something else, or you don't have to find another thing.
Yeah, there have been times where an agency, perhaps they haven't had the opportunity to get their folks trained, or maybe they're just a little uncertain. And so with one of our agencies in the Youngstown area with their juvenile court program, I said, hey, I'll join you all to get through this sort of first series, and then you'll be better suited to do it in the future. So we gathered for roughly 7 weeks. Over the course of February, we took St. Patrick's Day off and came back together. And so the youth got to see me kind of on camera every day with their staff, kind of working through making proud choices. And that was, again, a group of all boys. And then there was a new boy that entered the program kind of midstream, and he's like, wait, what role play? You all are dating. Wait, you're trying to have, what's happening? Because he didn't have a point of reference. But at that point, it becomes second nature for the youth to work through their role-playing exercises, and it's all, you're just reading from your book. And so because that social contract had kind of been secured and they were buying into that, then the other youth, again, sort of quickly got on board because the folks who were already there were kind of championing the program. So it was great.
Awesome. Thanks for sharing. One more question I saw in the a Jamboard was, what would be different if we're offering online programming to system-involved youth? Does anybody have a response to that?
I would just say technology is imperfect. As we have all perhaps learned, hopefully in the last few years, to lead with grace to each other and sometimes to ourselves. We have to lead with grace with technology, because sometimes there are glitches, and that's like the flexibility that I was kind of referencing earlier, or maybe, goodness forbid, like COVID affects the cohort for a period of time, and so they need to kind of suspend programming, but then you want to come back and revisit it. And so again, if we have these sort of consistent partnerships and they understand and feel like they can rely on us kind of showing up to be that supportive system, then there's less time to stress. Don't stress about it. If we can't do this today, we'll create a workaround. We'll figure that out. We'll circle back to it. So yeah, it does happen. And also in some of our communities, again, we were very grateful that one of the agencies was able to provide tablets to their youth, and they issued them. So that's how we were able to do programming, because otherwise we just wouldn't have been able to reach them. And some in District 2, for instance, like some of the partners could be an hour and a half or 2 hours away on either side of us. So we have really been kind of saved by technology because we can tune in to wherever they are to offer, prep.
Awesome. Well, thank you. Oh, go ahead. Go ahead, Rachel.
I was just going to add that if you are considering online programming, Maurice mentioned this, but making sure that young people have access to a tablet or a phone or a computer, but also the internet, in that internet access is not in all communities and for all young people. So just keeping that in mind.
And then I think Doug brings up a good point that engagement and trust is difficult to build virtually. So again, leading with grace and understanding it's going to be different than it is in person, but trying to work through what you can.
It is, and sometimes our providers have said, again, we sort of lead with that incentive, but part of that incentivizing program is to say that youth, this is a very interactive, we do invite you to participate. You need to have your cameras on. We kind of try and lay out all of that groundwork. And some of the youth that I have been with are also able to self-regulate. And if they're like, so listen, I will answer these questions. I don't want to have my camera on full time, but I'm absolutely here. I will chime in. I can use the chat. And so sometimes if you're able to give a little autonomy and be flexible, there's that word again, in the midst of those situations, I think that can help to cultivate, a little better rapport and hopefully help you get through to the end. But it's a great point, Doug, because sometimes even when we're in person, right, it can be difficult to cultivate that sort of cooperation. But if we're all trying to be those educators and instructors and teachers that left us feeling the best, and that's how we kind of show up for the young people, and then we consistently show up, I think that can be, some buy-in too, because you're saying, you're asking me to do all of these things, but how do I really know that you're kind of worthy? And so we have to try and demonstrate that as best we can and invite the youth along that process, because we're kind of moving together. It sounds very like Pollyanna-ish, because I used to watch that, you know, back in the day, because I'm older, but like, it's true. And leading with grace, I can't even say that enough. I've learned so much about that in the pandemic. You don't know what someone's going through until they tell you. So don't make those assumptions, and try not to be too heavy-handed when you arrive.
Awesome, thank you. I feel like we could all take a seminar from Maurice on facilitation skills and connecting with youth. So this is great. I don't see any other questions in the chat, and I think we're getting close on time. So we'll go ahead. We did want to share with you that we do have a lot of resources on the exchange about this population or these populations. So we would encourage you to check those out. We will be making these slides available. We'll be sending a thank you to everyone that registered for the webinar today. And then the non-508 compliant slides will be available in that webinar, but we'll also, or in that email, and we'll also get these posted on the exchange as well. If you want to go to the next slide, we have contact information for everyone who presented today. And I just put an evaluation in the chat. So if you would do us a favor and complete this evaluation, it takes 2 minutes of your time, and it really helps us understand kind of what went well about this webinar, if you liked the pace, what you want to see more of, and we're thinking hard about planning for next year. So we invite all of your feedback. And I just want to say thank you to an excellent panel of presenters. I know I learned a lot today. If you go to the next slide, and thank you to all of you for participating in this webinar today. We're really grateful for your time, and don't hesitate to be in touch if you want to explore these recommendations in further depth, or you have other questions that you'd like to troubleshoot with our team on a one-on-one basis. And with that, we will end the webinar. Thank you all so much, and have a wonderful afternoon.
Thank you all. Take care. Stay safe.